You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the Pharmacy Podcast Network's exclusive coverage of the 2025 American Pharmacists Association Annual Meeting in Exposition, held March 21st through the 24th in vibrant Nashville, Tennessee. This year's theme, Igniting Inspiration, set the stage for powerful conversations, bold ideas, and the renewed energy driving our profession forward.
In this special three-part series, we sat down with leaders, innovators, and frontline pharmacists to explore the current state and future of pharmacy. From workforce challenges and clinical advancements to policy, technology, and public health impact, these interviews shine a light on what's fueling the next era of pharmacy.
This series is proudly sponsored by PharmaStaff, your pharmacy workforce partner, and Yaral Pharma, advancing access to high-quality generics across the U.S. Let's dive in and hear directly from the voices shaping the future of pharmacy.
We are at the American Pharmacists Association Annual Meeting 2025 here in Nashville, and this is kind of a special announcement, and you're hearing it here first on the Pharmacy Podcast Network's coverage of the APhA 2025 with my friend and fellow Brownzillian. Is that how to say it?
I guess so. I don't know if anybody knows what Brownsville, Pennsylvania is, but yes, we are connected by region as well as other things.
Stephen Beckman, CEO of Yaral Pharma. Hey, so something that is special that we're going to be coming out with, we're launching, is the Executive Dose podcast, which is Pharma to Pharmacy, and this is insights for the C-level executive strategist out there in the entire pharma landscape and ecosystem, and how that ties into the execution of this through pharmacists.
Yeah, Todd, what you built here with this podcast platform has been amazing, and as a manufacturer, we have really valued using this medium and ability to reach out to a very important and definitive channel of healthcare delivery, and that's the pharmacy and pharmacist tech, the whole universe of pharmacy. And getting to know you and seeing the power of podcasts, very excited that we've come together to create this new podcast series. And really, the goal for me is to take this platform and bring other C-level or executive-level pharma people together and start having a conversation about critical topics that are not only important to us, but also translate down to the pharmacy. And maybe through this conversation, we'll have the opportunity for pharmacy to get to know manufacturers better, manufacturers get to know pharmacy better, and together, through that exchange of knowledge capital, we'll find better ways to work together. So I'm very excited to bring on a range of people that I know working with you to talk about a range of topics. We've got all kinds of things that we think have practical application on both sides of the fence, from the role of AI to supply chain challenges and shortages and how that impacts to resistance to change, and just how we are all trying to better ourselves in a way that ultimately better the patient.
Absolutely. So when I think of the CEO listening right now, and you may be CEO of a hospital system or a specialty pharmacy, the advantages of this platform, of this podcast, to be able to dial into executive thoughts and executive insights and how things are moving forward. When I think of drug shortages in the manufacturing space, we have to let pharmacists know what's going on. We can't wait to the last minute. Then all of a sudden they get on their pharmacy management system the old death red light that says, hey, this is not in inventory anymore, and kind of staying ahead of it. And so I think that that's one of the exciting things for me, is seeing that you're going to help me bring in leaders that are going to be able to really get into some of these topics and informing our pharmacists and educating our pharmacists what's really going on.
Well, you make a very good point, Todd. And, I think of it this way. I'm a pretty simple guy. So, I've spent over 30 years in this industry, both on the brand side and the generic side. And, from a manufacturer perspective, I think we have a tendency historically to talk at people, whether it be physicians or pharmacists or whatever. We're always talking at them. We're talking about, here's our product, or here's our portfolio, or here's how you should do it, or this is how education should be delivered to your particular constituency, or things like that. And I think what I want to do is I just want to change the paradigm a little bit to talk with. I want to talk with people. That's why we're here at this meeting. That's why I take the time personally to come to walk the floor, meet the people that we ultimately have to collaborate with to create value through the whole healthcare supply chain down to the patient. So for me, this platform and this podcast hopefully will be a kind of a renewed and refreshed way that we can talk with each other about topics that do actually have impact across all the different channels and delivery of healthcare. And through that will be a better understanding, a higher level of knowledge of exchange of knowledge capital, I should say. And then we learn, they learn, and together that makes it easier for us to find solutions that ensure that pharmacy and pharmacists, independent pharmacies continue strive and get stronger and better with the ever-changing dynamic, and through that inter exchange of information and dialogue, we'll get smarter because at the end of the day, we have to listen first. If we don't listen, we're never going to get it as right as we can, and that's what we want to do here at Yaral.
Stephen, we appreciate your leadership, your guidance, the guidance that you've provided us in our publication as well. We are looking forward to launching the first episode of the Executive Dose, Pharma to Pharmacy, and stay tuned for more from Stephen Beckman and the Pharmacy Podcast Network.
Todd, it's always a pleasure.
Jessica Beal, Dr. Jessica Beal here at the APhA 2025 post-show coverage. It's so good to see you.
So good to see you, and nice to meet you in person for the first time.
It's so funny when we spend so much time with each other online. I feel like I know you, but I've never really met you, and it's weird.
It is, but it's so beautiful, too, that the internet has allowed us that connection, and then to get to meet people in person is so fun.
All right, so the reason why I'm so excited about you being here is the evolution of sports pharmacy and how you've been one of those pioneers. And I think of people like Scott Chelson, Dr. Chelson. I think of Dr. Welsh, Brandon Welsh's team. I think of you. This sector of pharmacy is so under-leveraged for high school systems, college level, the NCAA, professional. I'm thinking of basketball. I'm thinking of the NFL. So give me your overview, because you've been doing this a while. It's not like you just did this overnight, but give me the evolution of where you see it taking fire finally.
I think I'm first starting to see it take fire in the NCAA level, where you're having college of pharmacies with high-end athletic departments that are dispensing medications out of clinical pharmacies in the university. So I see that starting right there as being a great melting point that's already, the touch points are there together. I also see it really strong in the community pharmacy. Community pharmacy, I practice there, so I'm a little bit biased there, but I think community pharmacies are trying to connect to their community and be that hub for just the patients, but also it can be a hub for athletes to have a trusted source.
I think of like anti-doping and how it's different from one state to the next, and it gets confusing. And I think of supplements, and I think of the rise of things like ketamine. And so, like, dial in for me and give us an example of something that you assisted a team or an organization with something, and then how we could like rinse and repeat that.
Yeah, so I do a lot of work with female athletes, and there are some medications that are banned that are commonly used in female athletes. So a lot of times we will look at, like, spironolactone used for PCOS is a banned substance because it's a diuretic. So making sure we're assessing these female athletes, are they eating enough? Are they on any banned substances? Is their birth control pill playing a role in things? So we're able to dive into the nuances of each athlete and making sure that their performance is optimized.
So what do we do to increase the connection between institutions, organizations, hospital systems, sports hospital systems that that have big presence. What do we do to kind of get the ball rolling faster than what it is within sports pharmacy?
I think showing our value, speaking up. Most people don't realize that pharmacists can play a role in sports. I think also the rise of making sure that we realize that athletes do use medications. They're not perfectly healthy individuals. They do need medications to support them in their endeavors, even if it's just for a chronic condition. So making sure that we're speaking up and showing our value as pharmacists and reaching outside of just being in pharmacy, whether it's to athletic trainers, to nutritionists, to sports meds practices, and showing our value there instead of just staying in the field of pharmacy.
We are excited that you got to be part of the post show. Stay tuned. Jessica will be back. We're going to be talking with Yaral Pharma. The CEO of Yaral Pharma is Stephen Beckman, and we'll be right back.
Special thanks to Yaral Pharma for sponsoring the Pharmacy Podcast Network's press coverage of the APhA 2025. Yaral Pharma is the U.S. subsidiary of IBSA, a global pharmaceutical company headquartered in Switzerland. By focusing on people and innovating the ways they're cared for, Yaral Pharma is proud to offer the same values and expertise of its parent company to the U.S. market. Learn more by visiting their website at yaralpharma.com.
Hey, this is Steve Beckman, CEO Yaral. We're back with Jessica Beal. Jessica, it's great to meet you here at the conference.
Nice to meet you too, Steve.
As Yaral is the manufacturer of both lidocaine patch 5% as well as diclofenac 1.3%, one of the things that we continue to explore is try to learn where our products best fit within patient populations. And given your background and expertise, the first question is, how do you look at pain patches? And then how might you look at the difference between those two products as it relates to managing sports medicine?
So I love the idea of topical pain management. We're not using, I'm really anti-NSAID all the time orally because there's just so many side effects that can impact performance. So being able to use something topically is a huge benefit for our athletes, and they can also use it just on that joint or just on the area that they're having problems instead of taking something that works throughout their whole body that they may not need.
Well, that's great. So obviously having site-specific or options in pain management is very important. Is there a particular scenario? I mean, obviously there's many different form factors out there, gels, creams, topical patches. Where does a topical patch maybe play different from some of the other non-oral options that you would consider?
Topical patches are really nice in the sense that I don't have to worry about, did it all absorb? Are you going to sweat it off? I live in Florida and have athletes in Florida, so it's always hot. So you're going to sweat off the creams really quickly. So being able to put on a patch and know that it's working in that area and you're not losing some of the medication is a huge benefit.
Wow, that's great. Well, anything else that you would consider important for using patches in terms of sports medicine or different just perspectives that you have?
I think it's important for pharmacists to work with athletic trainers also, because they're the ones often seeing the athletes and helping us educate the athletic trainers on different options that they have and why they may want to carry a patch or get prescriptions for patches versus using a cream or some of the homemade remedies that people use. So I think reaching out and being able to educate other providers that are working directly with athletes on the various options is really important.
And one last question, as a manufacturer, one of the reasons we come to these type of meetings is not so much to promote. I mean, sometimes we do, but most importantly, why I'm here is to listen and learn. Yeah. So what are the things that, is there anything that comes to mind that we as a manufacturer could think about what's important to you guys, either opportunities or challenges in terms of what we could do to support your community in terms of having products like our pain patches?
Yeah, so I think opportunities is just education and the different ways that it may be used. And being able to provide education to other providers that we might be working with on an interprofessional team. So I think that's really important as a manufacturer, because sometimes I get these long, lengthy CEs that I really enjoy, but sometimes I don't have the time and I just want brief information that highlights how can this be used in different settings, whether I'm in a hospital, but I work in a community, so most of mine is community outreach. So what conditions would I see more using this in a community versus in a hospital setting?
Well, very insightful. Yeah. We'll take that back and consider to look at those. Jessica, it's a pleasure meeting you.
To meet you.
Have a great meeting.
Thank you.
Bye now.
And now, Jeff Arbuckle, the Vice President of Sales with ScriptPro, is up next with an interesting discussion on the impact of technology on pharmacy care with our host, Todd Urey.
I'm here with Jeff Arbuckle with ScriptPro. However, Jeff, first time we met was through another technology and automation company, because I think we're starting to become the veterans of this profession. That's scary to say.
So true. Been in the industry for 30 plus years, both an outpatient pharmacy and inpatient pharmacy with a variety of companies, really for the better part of 30 years now.
That's wild. Yep. I'm celebrating 21 years in pharmacy, and it doesn't feel like 21 years at all.
Oh, no. It goes by pretty quick. I guess that's the way life is.
Yes, exactly. All right.
But we're not getting any younger.
We aren't. We got to start podcasting faster.
That's right.
We're at the APhA. How has ScriptPro and APhA, how have you worked together through the years?
Well, the show is obviously where everything is, the table is set for us to showcase our products and their services. We've participated for many years in the past. This year, booth's a little bigger. Mm-hmm. Our presence is a little more at the top of the list, where right as you walk in, you see us off to the right. So, we're participating fully and broadly at this show, more so than we have in the past.
So give me a rundown for ScriptPro in the sectors of pharmacy that we jumped in. When I entered pharmacy, I was in long-term care, institutional, then I migrated to community, then I went into combo shop, then I went into specialty. So I've been able to kind of experience the different sectors. Where does ScriptPro have your greatest strength?
Well, that's a good question, and I think the way to look at ScriptPro as a company is that our solutions are, they cooperate with each other, and our development of our first product, which was the first vial filling robot about 30 plus years ago. And as we bring these new products to market, we understand that the broader ecosystem in pharmacy, whether that pharmacy is associated with an FQHC, whether the pharmacy is part of a health system, independent pharmacy, a large chain, they all are operating in this pharmacy environment. And at the highest level, we're taking medications that are provided by a manufacturer, and they float through this rather complicated supply chain that includes PBMs and payers and competitive alternatives to traditional pharmacy, and then ultimately it gets down to a patient who needs to take that pill. Yeah. And what we try to do, regardless of the specific industry that the pharmacy's in, is we try to straighten that out for them. We try to take the burden of the complexities of that supply chain, out of their responsibility, and create an environment where they can go about doing, pharmacy activities, practicing at the top of their license, and as a result, be of greater impact to the patients that they're caring for. So we participate in all elements of pharmacy, like you said, retail, independent, health systems, FQHCs, community health centers, VAs, DOD, everywhere. We're in thousands of pharmacies across the United States, retail and others. We're in 650 to 700 health systems with one or more of our products. And I think another perspective of ScriptPro that's often overlooked is that we've developed all these systems, and the natural takeaway from having all these different systems that are coordinated for the delivery of pharmacy services from a variety of different markets is that we understand the whole process. And the primary takeaway is that, we got one-stop shopping, right? Yeah. And that is definitely an advantage to those people that make that choice. But I'd also like to keep in mind that because we are involved with the whole process and the whole pharmacy use process, that every product that we design is understanding that downstream and upstream there are handoffs that need to be made with these other systems. Yep. And our systems, I think, are sensitive to that. We're not just focused on either a pharmacy information system or robotic vial filling machines, but those machines understand and play nice with all the other systems there. So from a ScriptPro perspective, when companies reach into our bag and pull one of our solutions, we believe that because we design our solutions with that knowledge and understanding, that we make the other systems that they already have better.
Yeah.
Because we play nice and we operate seamlessly with all of the systems. If you want to buy ours, we love that to happen. Yeah. But if we don't, you're still going to end up with a better solution because we understand that whole medication dispensing process.
I wanted to create a T-shirt 10 years ago that said "Death by API," and the dreaded API of having a pharmacy management system, and you had it, and it's working well, and now you want to add some automation, and getting it to flow and to back and forth. Right. And you guys really specialize in that.
Right. The interfacing or the APIs that we create, we've got over 100 of them with various pharmacy information systems and EHRs, across the whole continuum. But, like I said, at the end of the day, if you wanted that to be seamless, we also have a pharmacy information system of our own that it comes integrated.
Yeah.
If that makes sense. And once again, I think the real value is our understanding that in order for our system to be better than maybe our competitors or to be slightly different anyway, is we understand if you're a pharmacy information system, we know what you're struggling with because we got one.
Yeah.
And as a result, the product that we insert in your workflow process, for example, hopefully makes your system, our competitors at some level, a better system if the customers aren't ready to go full house with us.
So same 10 years ago, if I jump back, it's 2015, and I start hearing about artificial intelligence becoming more relevant, more usage, very science fiction to me. I grew up, watching Buck Rogers, for goodness sakes, and the second one, the one in the 80s, that is, not the one in the 50s or the 60s. And what I'm thinking is, so I know how artificial intelligence, and I'm using it, lots of what I'm doing is I love to write. So I'll take a story, and I will plop the story into a ChatGPT, and then I'll tell it, don't change my story except for spelling and grammatical errors. However, take the story and make me a more technical example of it. So, and when I do that, I get to keep my personality, but then I get this beautiful other piece of literature or of the blog that really takes it and does make it much more technical and breaks it down into sections. And I just think that's wonderful. So I'm finally getting my use of AI as a publisher, as public relations, as someone who does a lot of writing. How is ScriptPro leveraging AI right now?
That's two edges to the same sword. The first edge that we see is like you, the user or the pharmacy or maybe the patient's interaction with AI to make the process and the experience of interacting either with a pharmacy or a pharmacist either more efficient, faster, more informative, more impactful, and those are kind of the visible elements of AI. And I think everybody is focused for the most part on that because that's the one that touches us. Yeah. But if you really look at it from a business perspective and what it offers companies like ScriptPro is we have to develop a lot of code. We've got a lot of things that need to be developed, and if we deploy AI in our development efforts, the impact it will have ultimately on the products that we provide will be far greater than maybe that personal experience that people might be looking for. So I think from a ScriptPro perspective, we're looking at AI on a kind of a business level to start with. But I'm sure you'll begin to see elements of that in terms of the code we write, the products we release, the speed at which we bring them. Yep. All those are advantages of what AI brings in the development world. But I think as we begin to venture down that path, you'll find us being more, let's say, person-facing kind of elements of our systems, whether it be, point of sale and the ability to sort of understand what the patients respond to. Text, do they respond to email and the like? And an AI, agent can kind of figure that out as a person does today, or unfortunately probably doesn't do today. And they just decide that we'll just text everybody, or we'll just send them all an email, and those that respond to it do, and those that don't get mad at us, I guess.
Jeff Arbuckle, ScriptPro, this has been a wonderful time spending at the APhA 2025. We hope to interview you again in the future.
Sure, look forward to it. Thanks a lot, Tom.
All right, we are back at APhA 2025 here in Nashville. Boots kicking, of course. Last night actually was the exhibit hall, the opening reception. Good time had by all. There's crazy lighted cowgirl hats everywhere. But here, as Mark Payne Guy Garofoli, really welcoming to the table, to the conversation here in the mic, Stephen Beckman, of course, from Yaral Pharmacy. Really to open up the conversation, there's a lot of different companies, organizations, products, medications, things to help our patients all throughout this conference, the exhibit hall, and of course in the hallways. But really want to, open up the conversation of, what to talk about when it comes to the, the pain side, pain management in these hallowed hallways here of the exhibit hall.
Well, Mark, it's always a pleasure. Now this is our second year that we've had the opportunity to talk, and as CEO of Yaral Pharma, we're very appreciative of having somebody like you to work with as a leader in pain management. And yeah, Nashville's a pretty fun place to be. A lot of live music. You forget how good live music is when you don't get to hear it very often. So, as we've been talking over the last year, Yaral does produce a couple of pain patches, both lidocaine 5% and diclofenac 1.3%. And, a lot of things that we've talked about last year is, I think, important maybe to revisit or restate, in that you have really pushed the theme of having options in pain management. So maybe we just start there, and why you need options in pain management from a form factor as well as a chemical alternatives.
That idea resonated with me in the presentation I got to be part of this morning, actually. I was honing in on controlled substance red flags, but and folks talking about, what do we have? How do we help our patients? Because one of the quintessential scenarios is patient in pain will present and say, I've tried everything. How can you help me? And it's kind of a convoluted question when you think about it, because it's like, hey, there's no options, but you, Mr. and Mrs. Magician, help me out here. It's like, well, odds are you haven't tried everything when you consider the combinations, and, we all know how math works, and you multiply it out, and there's millions of options when you talk about combinations. But regardless of what someone has tried or hasn't tried, we as clinicians, as pharmacists, we've got to know what's available out there, and we can't have blind spots. Not just saying it from the book that's out there, but we can't forget what our options are. And when it comes to things like topicals or even OTCs or you name it, the things that aren't on the gamut. I mean, hey, everyone's heard about an opioid, right? Everybody's heard about non-opioids as well too, but we can't have the blinders on of what are those other options out there, whether it's a different formulation, whether it's a truly a different medication class. It comes down to how's the thing work and how much of it, and how we can help our patients.
Yeah, and I guess one of the things that's a true factor in life is that not everything works the same for everyone. Yeah. So I think it's important that, to your point about having options, allows you to continue to work through before you go to the worst case scenario. It's kind of like when you titrate up. You want to start with the lowest effective dose, or you want to try something that might work a little different. And that's where pain management really takes that kind of one-on-one relationship between patient and pharmacist, or patient and physician.
Yeah, it's not completely exclusive. You think about a lot of mental health genres or medical conditions. There's a lot of regardless of how objective something is. In the end, it's a medication, it's a dose, it's a number, it's perceived as objective, but there's a lot of subjectivity in it. And boy, pain management is like, the quintessential idea for that. There's a lot of subjectivity. Your 3 is my 7 on those illustrious pain scales and all that great stuff in the background. How do we translate that to actual care? When you're on the diagnosis side, on the evaluation side, translating to treatment, and then again, not forgetting what your options are, because the clinician mind in the background is constantly thinking, okay, here's the assessment. What's going on? Where in the body are we? Not just, arm, leg, back, but really deep in there. What's going on to figure out how that translates to what treatment and what formulation along the way.
Well, obviously, you know about the two products that I mentioned that we have, and I do want to just make a note that for anybody listening, please visit our website, www.yaralpharma.com, where you can provide, and all the information is provided regarding our safety profile and all the information, product insert, and we recommend that you go there and or reach out to us directly through our medical information, and we're happy to answer anything through our medical communications team. But back to our two products, we were talking before we got live about variations, and how do you see the difference in use in terms of like a lidocaine versus a diclofenac?
Ooh, head-to-head. Everybody, that's like a clinician's dream of looking at head-to-head, what you do here. It really just, it goes back to, us healthcare professionals, we complicate things like no other. But in the end, we survive, we thrive on the simplification of things. It really comes down to, regardless of what single or multiple pain conditions a patient is presenting with, diving deeper of saying what's going on in the body. Once knowing that, then it's really going back to the simplicity of the medications or non-pharmacological treatments too, of what do they do. It's matching A with B to get patient care along the way.
So really about mechanism. Is really understanding the human mechanism, if you will, and the dynamic that the patient's presenting, and then looking at the mechanism of the individual drug class or form factor in which that drug is delivered.
Yeah, you're talking to a pharmacist. We care about a lot of things. Two main things, mechanism and dose, to lead to safety, efficacy, drug interaction, side effects, and of course efficacy along the way. But at the core of it, the initial part of this equation I just made up is the how's it work, what's the patient got going on, match those along the way, of course.
So, Mark, one of the reasons why I attend these meetings as the CEO of the company, and we've made a commitment to the pharmacy channel as a whole, as a company, is to listen, to learn. So when I ask this question, it's really more from a pharmacist or pharmacy perspective. What as a manufacturer do we need to be thinking about going forward? I mean, there's always a lot of opportunities, and there's challenges associated with pharmacy or being a physician or even being a manufacturer. But since we're here today, does anything come to mind that you think is important that as a manufacturer in the space of pain management and inflammation that we should think about, or how can we better service the pharmacy community?
That's a good one. And
I didn't mean to surprise you.
It's keeping it simple, though. It's really awareness and access. Pharmacists are going to know what the toolbox is, in this case for pain management, but it's remembering what's available there too, and then the actual access to it. So say, we're talking community pharmacies in general. They are literally ordering all of the products. It's keeping what's available, what's needed for that community, what local prescribers, the whole interprofessional access idea is, but not just the product, but also the knowledge, the education side of knowing, like, hey, these are any given medication. These are options that are out there. You've got to remember those too. Because when a prescriber asks, hey, I'm up a creek here. We've tried, I'm giving quotes, folks, we've tried everything. What do we do now? And it's like, very often the answer is, what was skipped over 15 steps ago? Hopefully not 15 years ago for a patient, but not forgetting those options that are out there and increasing that education, obviously with the products along the way as well too, but just the awareness of hey, here's what's available. Here's how you make sure you keep these things, because we got to arm our pharmacies with the actual medications to be able to help people in the community. So.
Well, I've got two final questions as we kind of wrap up our time here at APHA. Sure. The first one you mentioned in your last comment about awareness. Mm-hmm. So awareness is a fairly general term. So when we think about awareness, there's mediums in which we create awareness. So I'd be curious because, pharmacists are so busy.
Oh, yeah.
And pharmacy environment's so busy. So there's many ways we could potentially create awareness. But are there ones you think under the current circumstances that are better than that? I mean, we used to put print ads, or we could do different things. I mean, but if we're going to create awareness to make sure that everybody has everything in front of them, the knowledge capital in front of them, do you see anything that works better for a pharmacy given the dynamics that they work under?
These days, really, shotgun. Everything you said. There's also budgets that come into play with all of those activities along the way. But, really different folks, it's like education. Different folks learn things different ways, whether you're a visual learner, a doer, a seer along the way. You mentioned like print ads. That is one avenue. If that print ad is going to many tens of thousands of pharmacists, that's a good option. Conferences, hey, we're at APhA, the umbrella of pharmacy here. Or maybe it's a specialized conference. That's another avenue. It's quality and quantity and balancing that. Good luck. You're in charge of that along the way. But it's the shotgun approach is, really important because going all in on one, it's like having blinders on then. So really getting that information out to us as pharmacists in different avenues, because we're all in different avenues.
Yeah, well, it makes a lot of sense practically. Obviously, people learn different ways or have time to absorb information in different formats and so forth. But we always try to see if we could be just that much better in doing it. So one last question for you. I had a very intriguing conversation with a young lady here on the conference earlier this morning before it opened, and she was a pharmacy tech.
Okay.
And she was a pharmacy tech advocate. And, I've been around this industry for 30 years, and there's physician advocates and pharmacist advocates. First time I actually sat down and thought that there's people out there actually advocating for the pharmacy tech. And I was curious what your perspective is on the role of the pharmacy tech playing for, because it really struck me pretty hard today that that's an opportunity for us, whether it be what we just discussed in terms of awareness, but the role that they're going to play and continue to play, and the pharmacist is going to continue to play as we unfold, to the point where in some states maybe they're going to be able to make switches of products from in the same class under a different form factor. So how important do you think the pharmacy tech is going to be going forward along with the pharmacist?
Incredible. Certainly unsung heroes. I used to run community pharmacies. I have never run a pharmacy as the pharmacist in charge or pharmacy manager, whatever we want to call them these days. I've never run a pharmacy where the technicians weren't the most important people in the building. Now, there's obviously laws regarding us pharmacists and what we have to do, and the knowledge and skills of pharmacists across the country are incredible. But the unsung heroes, not actually in the background, they're literally on the front lines. The first and sometimes only person somebody will talk with in a pharmacy is the pharmacy technician. Yeah. That's where it's at. And many pharmacists recognize that, embrace that, and advocate in that order. But it is something to amplify along the way. Absolutely.
Well, we're surely going to take a harder look at whether or not what we can do as an organization to reach all the decision makers. Mark, I just want to say it's been a pleasure to have the opportunity to know you and work with you over the last couple of years to raise awareness about general perspective and pain management. Yaral is obviously proud to be a small part of that in terms of offering products where appropriate, make the most sense for those patients. And again, to close, I would just again remind everybody to please visit us at www.yaralpharma.com. You will find all the information on our package inserts of our products, all the background information appropriate on the safety profile and efficacy profile of the drugs. And we look forward to our next discussion with you sometime in the near future.
Absolutely. And hey, the vibrancy continues here on the floor at APhA 2025. And hey, folks, check out the Pain Pod here on the Pharmacy Podcast Network, of course. And if you want to, another website for your homework, painguide.us. Hit it up anytime. You can contact me directly. But as I say to everyone everywhere, wish you a great day every day.
Excellent. All right. Well, thank you very much. We'll talk to everybody soon.
Kathy Campbell here at the APhA 2025 press coverage here at the Pharmacy Podcast Network booth. Kathy, it's great to see you.
Nice to see you, Todd.
All right. I'm excited about you being here because Food as medicine has been a concept that we've been talking about on and off the podcast. A whole bunch of different pharmacists that have brought it up. A little series of one of the episodes we did with you a year and a half, maybe 2 years ago, we were talking about that was the tip of the iceberg. But you're doing things at a whole nother level now. You're going to be building a network of wellness pharmacists that are going to dial into disease state management, and we're going to see the medications starting to disappear more, and we're going to start concentrating on what are you eating, how are you eating, when are you eating, and really dialing into people's health from a preventative perspective instead of always throwing a med at it. And to me, that's where a lot of our pharmacists want to go anyway.
Oh, it's the pharmacist's heart. It's who we all are. The biggest surprise, the biggest kind of secret in pharmacy is pharmacists don't like taking medications because we know too much. Mm-hmm. And really, it's called I call it proactive healthcare, the new business of pharmacy. And what is that? I don't want you to need medications. Mm-hmm. Now, if you're stable on a blood pressure medicine, we're going to work really hard to optimize all of that so you don't have the stroke, mm-hmm. right? But what if we could increase basic function so that you didn't need medicines? Health is not taking 10 medications a day. Health is closer to not needing it. And the pharmacist is perfectly suited with our training, with our empathy, with our positioning to be that trusted partner in health, not just disease. So this is all prior to the diagnosis. Mm-hmm. And consumers want it. Consumers with the internet now have access to so much information, almost overload. Mm-hmm. What they don't have is context. And that's where that trusted therapeutic relationship is the new model. It is about being that source for them to go to bounce things off of in an effort to be well. Food is biochemistry. I call it food pharmacology. Mm-hmm. And pharmacists know chemistry in ways that nutritionists don't. And so if we can just start extrapolating the biochemistry of food in how it impacts basic function, we got to work on function, and then look at the medications or the need for the medications and factor that in, we'll have incredible surge of health, and there is no shortage for that need.
I love it. I love it. So let's talk about application and the easiest places to start. And I think of our community pharmacists. Mm-hmm. And I think of community pharmacy out there who's struggling to make non-prescription based revenues, mm-hmm. and being able to do more life coaching or more what should I be eating coaching. I go on TikTok a lot and follow several pharmacists. Dr. Katie Forbes comes to mind. She's wonderful, and she demystifies things, and she talks in a way that people understand, so the consumer understands what she's talking about. And she debunks a lot of bad information out there. Matter of fact, I follow another pharmacist, I can't remember her name, that demystifies all the kinds of magnesiums, mm-hmm. because people are like, oh, I'm on a magnesium now. And she's like, but which one are you on? Because that's a big, are you one for the more or for your brain, for your muscle, yeah. how it absorbs, etc. Exactly. So therein lies how powerful a pharmacist can be dialed into this trend. And not a trend, just doing it forever. Oh, it's what we need. And I'm a community pharmacist. I've been in the same community for 33 years. I've had the profound privilege of serving 4 generations of patients. I have gone in this direction because we're all aging, and I wanted patients to age well. And I've known these patients longer than I knew my mom. So I didn't want to get the call saying I had cancer or the heart attack. So I started diving into the science of longevity. And function is a critical component. So one of the things that's missing in our current healthcare system is nobody has good basic function. And what we're doing is we're having bad function for long enough, and we're chasing it. We're calling it something called a diagnosis, and then we're trying to chase that symptom. And if you can just help with basic function, basic nutrition. I mean, nutrition, I had a doctor tell me one time, when did nutrition become alternative? Yeah. It is foundational biochemistry. And we have 73% of our national food system in the United States is ultra-processed. So that means 3 out of the 4 things your children can choose to eat will hurt them and have them live a shorter life.
That is not a lifestyle choice. That is a cultural problem that can be fixed individually. And that's what I support people do. I get them a little mad about those kind of statistics. It is hard to be well, but it's not hard because of personal failing. It's hard because we live in a society that actually profits heavily off our illness. And until we individuals take charge, I mean, I'm hoping that we'll have a cultural shift in that. But I empower people, and people pay me to support them in correcting that within their own sphere, within their own microculture. And then what I see is incredible outcomes. We're talking A1Cs that go from 13 to 7 in 12 weeks. I mean, those kind of things aren't just outcomes. That impacts the quality of their existence. So I'm a community pharmacist. I had to figure out how to do this. So the fundamental first thing that you have to do to make these kind of impacts is talk to a patient. So you have to have a structure called an appointment. And the appointment, a lot of pharmacists are having trouble with that concept because, well, what happens? The appointment's for the patient to tell their story. You know, pharmacists are exquisite at really talking to patients in 5-second intervals. Now imagine if you had 15 minutes.
Right.
Imagine if you had an hour. What the patient could fully dive into and what the pharmacist could prompt to really tease out their issue and then create solutions. Pharmacists know how to do that, and it's no different. But you've got to have a time and a structure to sit down with a patient. Then you have to value that structure, and that is a value proposition. And that's something that I've learned to do. Patients can't buy what you don't sell. And so you have to sell that appointment. And most of the owners realize that their time is not the price you put on that. You know, a lot of pharmacists are like, well, I'm worth $50 an hour. Well, that's not really the value of what you're providing. So structuring that value proposition to the consumer and then deliver. The hard part's not selling it the first time. The hard part's selling it the second time, because you have to deliver value. And when people have help being well, they value that. But pharmacy's going to have to structure our offering and our profession to the consumer differently. We're going to have to start having a different narrative. We're going to have to start having marketing, and we've got to shift consumers seeing a wellness pharmacist as a critical component on their health team. And so that's really one of the biggest initiatives I'm working on, is creating the subspecialty in pharmacy called the wellness pharmacist.
I love it. And you're creating a network of these pharmacists as well.
I am, because right now nobody knows where to go. So we're going to align these networks of aligned pharmacies that are structured to provide basic products to help people be well. And the first basic product is that appointment.
That's great. Kathy Campbell, we can't wait to do more explorative podcasts with you under the Wellness Pharmacist theme. And if you're listening and you're interested in learning more and networking with Kathy Campbell, what's the best way to reach out to you? drkathysays.com. You can reach me there. Kathy Brooks Campbell on Facebook. I'm there too. I went to school with typewriters, so technology is all around me, and I harness what I can. So feel free to give me a call. Excellent. Thank you for being part of the show.
Thank you, Todd.
Hey, I'm here with Niklas Sandler from CurifyLabs. Niklas, thanks for joining us on the show.
Thank you.
All right, so right out of the gate, I want to know what CurifyLabs is. The very first thing I think of is blood testing.
Well, it's not anything like that. Yeah. We're actually a company that automates the way compounded drugs are made. So we have a technology based on 3D printing that basically takes compounding to the next level in a way.
Well, compounding is a rising part of our community pharmacies where they're doing more non-sterile compounding. Is CurifyLabs doing non-sterile, sterile, hospital system, specialty, infusion? Like, talk to me about the different sectors of pharmacy that you're carrying.
Yeah, very good question. So we are actually focused on non-sterile manufacturing or compounding. So we thought that there hasn't been anything happening in that field basically at all if you compare to sterile manufacturing in the compounding space. So we have brought the technology specifically to that, and it's basically serving compounding pharmacies, basically community compounding pharmacies, and then also hospital system compounding. Yeah.
And how is artificial intelligence accelerating, assisting, helping your organization to get better information out there for pharmacist use?
Yeah. We use it in different ways, but one of the ways is that how basically because our system solution, as we call it, is a digital way to write or basically compound the drugs. So there's a prescription coming in, and then we have basically a formulation library, and the pharmacist has access to that, and they choose from that digital library the specific prescription to be manufactured or compounded, and then the system basically guides automatically or does it for the pharmacist. And in that process, AI obviously plays a significant role, specifically in the future, because everything is based on data that it's in the system, and to optimize then the treatments in the end.
There's software involved, there's hardware involved. Talk to our listeners about the footprint of the actual device, and is there different types of application? Is there bigger systems that you have for bigger pharmacies?
Yeah. We currently have one type of system on the market. So basically it's a laboratory device equipment. So it's actually a combination of devices. There's basically a mixer, then there's the printer, and then a heat sealing machine for blister packaging, and the software, of course. But it's a benchtop device, so basically fits into any smaller pharmacy as well.
Very, very good. And so when I think of, once again, the expansion of our independent community pharmacies that want to do more compounding, they want to do compounding for pediatrics and pain management and topicals that are helping with something that's happening. So there's an element of cash-based opportunities, running things through your insurance. I'm also hearing about the rise of veterinarian medicine. Have you done any compounding in the vet space?
Yeah, actually we do. We have vet formulations in the library as well. And actually I forgot to tell in the beginning that we also have these proprietary excipient bases that go with the system. So there is several for the human side, and then we have a vet-based formulation excipient base as well, which is, currently beef flavored, but yeah, it has been well received.
All right, let's talk about interconnection and APIs with pharmacy management systems out there. Is your system able to talk with maybe a pharmacy management system of some sort?
Yeah, it can be run independently, but we have done integrations as well. So I mean, it's a software integration issue, but those are typically fairly straightforward. Yeah.
Very good. All right. So at APhA, what kind of interaction, what kind of interest are you getting from the pharmacists that are here?
Yeah, very good interest, and I think there seems to be a need for developing the non-sterile compounding space. So to take it to a new level. I mean, we bring quality to that sort of and standardization to the compounding. So I think pharmacists can sleep more at ease at nights when some of that sort of very manual work is taken away, and a machine can do it with a higher quality, and they can focus on other things in the service. Yeah.
Excellent. Well, we appreciate you being part of the post show. I'd like to have you back on This Week in Pharmacy so we can dig in, maybe bringing in a compounding pharmacist to have a conversation with you.
Okay, great.
All right.
Thank you.